case of the week. This case is actually really personal for me. This is a story about now my 4-year-old daughter when she was born. And this case is relevant to any parent who's ever had a kid who's been really, really colicky. So my daughter was born after a very prolonged and difficult birth. My poor wife had 24 hours of labor with 18 hours of Pitocin, and ultimately they had to yank my daughter out into the world. And from the very first day, this little girl was just crabby. She was irritable. Like you literally couldn't hold her because she was just upset. And both of us remember this vividly. And with my entire osteopathic training and everything that I've learned from all of these brilliant osteopaths that I work with, I'm like, great, here we go. Like we're going to be now part of that statistic of colicky kids. So day one passed, crabby, just we couldn't console her. She would sleep a little bit, wake up crying. Day two, kind of the same story. So finally, I called up one of my buddies, Eric Dolgen, just incredible osteopath. I mean, my wife calls him a Jedi. This guy, in one treatment, got rid of literally years of back pain that she endured. So for all of you people who don't know who osteopaths are and you haven't worked with a good craniosacral therapist or a chiropractor before, especially in this world of cranial osteopathy and some of these other healing modalities, it is incredible. It is incredible what these people can do. Context, we were in a car accident. Shortly after my brother's wedding, we got rear-ended. I was sitting in the back seat. My brother and sister-in-law were in the front seat. We came to a standstill on the freeway. Another car decided not to stop and hit us at 45, 50 miles an hour. Next day, literally, I couldn't move. Like my neck, my back, my entire body was so sore. So sore that literally I couldn't function. So again, I called up Eric, and there's many great osteopaths just in the Los Angeles area and others, and we use all of them. But this isn't an advertisement about that. I just happened to be friends with this incredible man who was one of my teachers. And, I called him. I'm like, I'm a hot mess. Can you help? One treatment, all back pain, neck pain, headache, soreness gone. That's what these folks can do. I'm technically an osteopath. I suck at it. You do not want me treating you or your kid because I can't pull anything off. And I'm very clear on how badly I suck in the world of osteopathy, but I know people who are really good. And they may be able to help you and they may be able to help your kid. Now, what does this have to do with my daughter, right? What does this have to do with my daughter, and what does it have to do with kids who are colicky? So just stand back for a second. If any of you have had the misfortune of being in a car accident, if any of you have ever had an injury and you're just like, God, my neck hurts, my back hurts, and you just have that chronic just pain that doesn't go away. Now, think about what happens to a kid, especially when Pitocin is used. So Pitocin creates these massive contractions. I mean, you moms who have had Pitocin, it's no joke. The muscles are just, right? And you've got this 7-pound, 6-pound, 8-pound human being, this little human being with all of these muscles going boom, boom. And they're getting shoved through the birth canal at massive forces. And that happens for 18 hours. Imagine what your body would feel like if after 18 hours you're just getting shoved in, and it's not going through the birth canal. It's all the force that Pitocin especially uses to do that. And sometimes it's necessary. I'm not judging the use of Pitocin. We had to use it for both of our kids to get them out, and that's fine. But when all of this force is going into a little 6-pound body, and with my daughter, the OB had to actually use a little bit of vacuum to get her out because she was stuck. And God bless him for doing his job. Dr. Goldberg is a fabulous guy, and I adore him. And he had to do his thing. And I was like, you do you. Make sure mom and baby are safe. We don't care about anything else. But imagine, little human being, 180-pound guy pulling on her head as all of this muscle is pushing her out. If that was you, would you have a little neck pain? Would your back hurt? Would you be comfortable? Probably not, right? So the same experience I had in the car accident is perhaps, we don't know what, 1-day-olds, 1-week-olds go through, right? It's not like they can tell you like, hey, my neck is kind of hurting right now, right? They can't tell you that. So what happens when babies are uncomfortable? They cry. They cry and they cry and they cry. and they can't get settled and they can't get comfortable. And then you're like, why the hell are you crying, little kid? So fast forward, this was the story of the first 4 days of my daughter's life. We get an osteopathic adjustment, and I kid you not, I swear on, my life, my wife's, like, this was real. This is real. Within 1 day, this little girl who was difficult to console, crabby as can be, irritable, boom. Best sleeper, sleeping 3 or 4 hours at a time, feeding well, everything was good. And it was just like crabby baby, not crabby baby, one treatment. Now, sometimes it takes a little bit more work to that. And sometimes it's because the kids have tongue ties. It's sometimes because they have a poor latch. Sometimes they have digestive issues. So this isn't the cure-all for everyone. This isn't that every kid with colic gets a treatment and they're better. But when you have that story of intense contractions with Pitocin, plus or minus a vacuum or other assisted delivery, and then from the moment the baby is born, and this is one of the things that's very, very specific. Kids who have tummy issues don't develop colic first day. They develop after 2 weeks. They're the 3-week-old that suddenly is losing their mind, but they were fine before. Babies who are born right at birth have a lot of restriction. And when you can use various modalities, including osteopathic medicine, craniosacral modalities, sometimes chiropractors do the craniosacral. When you can do these gentle modalities, we're not popping something back into place. We're not trying to do any aggressive adjustments. It's like a massage. When you can leverage those kinds of soft, gentle modalities to help a baby and they get that release, all of a sudden it's like, and then all of a sudden the baby's calm. The other part that's really interesting about this conversation is as I consult with a bunch of older kids' families who have anxiety, various issues, a lot of times what we find is that same kid who's now 8 years old was the baby who was 1 day old, 5 days old, 2 weeks old, who was crabby, and they never were able to regulate. If you're curious, there's actually a book called Accessing the Power of the Vagus Nerve. And there's polyvagal theory. There's all of these terminologies around this concept that when you release tension in the back of the skull, and it's way more complicated, this way more complicated. But when you release the tension in the back of the skull, what happens is these babies suddenly can activate their vagus nerve. And the vagus nerve is what we use to relax. Take a deep breath. You feel relaxed. That's your vagus nerve. These babies can't activate their vagus nerve. They can't use their vagus nerve because of the tension in the back of the skull, hence why they're crabby as can be. Information is power, and I hope you can help share this information with many, many people and get families the understanding that they need to help their kids. No cases are impossible to solve. We just need to have the right information. And I hope you can help me do my part to get this kind of information out there. Thanks for watching. This is Dr. K.